We're going to talk about understanding cultural differences and how it's a vital component of ethics and professionalism in sports medicine. It involves the ability of healthcare practitioners to understand, respect, and effectively interact with individuals from diverse culture, ethnic, and social economic backgrounds. By embracing culture competence, sports medicine professionals ensure that care is the same, inclusive, and tailored to meet the unique needs of all clients, fostering trust and improving outcomes. So, why does this matter? It enhances patient centered care. So, recognizing and respecting cultural differences allows practitioners to provide care that aligns with the client's beliefs, values, and preferences. Now, example of this is a Muslim athlete observing Ramadan. They may need an adjusted hydration and nutrition plan to accommodate fasting during training and recovery. It promotes diversity and inclusion by ensuring that individuals from all backgrounds feel welcomed and valued. Also, awareness of cultural factors that can help address disparities in access to care and treatment outcomes. So, understanding that some communities may have lower access to healthcare or face historic mistrust of medical institutions allows practitioners to build rapport and trust. It strengthens ethical practice. So, culture competencies uphold ethical principles of respect and justice by ensuring care is delivered from an equal way and free from bias. So, for example, avoiding stereotypes when assessing pain tolerance, which may vary in expression across cultural groups. So, examples of this in practice. So, communication and language barriers, providing interpreters or translated materials for clients who speak different languages to ensure they can fully understand and consent to treatment plans. Respect for religious practices, so accommodating practices such as prayer time or the way people dress for modesty or dietary restrictions during treatment demonstrates a respect for religious beliefs. For example, allowing a female athlete to wear long sleeves during treatment in alignment with her cultural or religious views. Tailoring health education, so modifying how health information is presented to suit cultural norms or literacy levels, ensuring the message is understood and retained. So, for example, using visual aids when explaining injury prevention to youth athletes. Inclusion of family and community. Now, in many cultures, family or community's input is really important to decision making in healthcare. Including these stakeholders respects the athlete's cultural framework. So, for example, engaging the family in discussions about a young athlete's treatment plan in cultures where family consensus is prioritized. Now, this also extends to other forms of diversity and inclusion, ensuring that the care is adapted to meet the needs of various populations. So, gender and sexual orientation. So, recognizing and respecting the need of LGBTQ athletes, such as ensuring inclusive language or providing gender affirming care. So, for example, using preferred pronouns and addressing certain healthcare concerns of transgender athletes undergoing hormonal therapy. The social economic status. So, tailoring care to be affordable and accessible, considering financial barriers that may limit an athlete's ability to attend sessions or afford equipment. So, examples of this is recommending low cost or alternative rehabilitation tools from athletes from a low income background. Disability inclusion, so providing equal care or access to care and facilities for athletes with disabilities. So ensuring that all aspects of the treatment environment are accessible. So an example of this is ensuring a clinic has a wheelchair ramp and therapy equipment is designed for these athletes. So culture competence is not just a skill, but an ethical imperative in sports medicine. By integrating cultural awareness into practice, professionals can provide inclusive, respectful, and effective care that aligns with the values of diversity and inclusion. This approach not only benefits individual clients, but also strengthens the professional's commitment to everyone being equal and ethical healthcare for all.